All right, and share. Okay. Can everybody see my screen, my PowerPoint?
Yes.
Yes. Okay. Good. Uh-oh. What did I do? All right. Okay, so this part is the part two, concept of mental health. So we're gonna finish it today. So unfortunately, and let me say that again. So the mental health sometimes just don't have some kind of like a very good structure. So that's why you don't have some kind of like a measurement or some kind of value to talk about how people their mental illness. So it's very difficult to define is it people and what they saw inside because we cannot guess, right? So that's why we need to decide well judge and by the outside the behavior and some kind of like their idea to see if they are kind of like a fitting in some kind of like a normal range as like a normal function. So today, the first thing we're gonna talk about is anxiety. Okay, so everybody will have a different kind of anxiety and a different kind of event. So, for example, like learning. So you are starting right now. That's why you have a certain of anxiety. And this is normal because you are learning something you're not familiar with, you're not very good with, and you're still learning. So that's why you feel anxious about, okay, how about if I don't doing very good, and how about I fail? So that's why you have a certain anxiety. So also for the patient. So for the patient, especially they have like a neurodiagnosis, and we just been telling, okay, you've been diagnosed with some kind of disease, like okay, you have a COPD right now, you have a diabetes right now. So for sure, from the beginning, it's gonna shock the patient and say, "Oh my God, so that means that I'm not healthy. So I'm not like a function like a normal person anymore, and I'll just like I cannot have some kind of like a normal activity. I cannot do what I want to do like before. So that's why they have a certain anxiety due to dealing with their disease. Even sometimes it's not disease dealing with their daily life. For example, like a job is very stressful, or like maybe marriage or just teaching the kids is very stressful. It will create a certain anxiety. That's why they cannot cope. They cannot dealing with their life. So here you can see the level of a different kind of anxiety: mild, moderate, severe, panic. So in N class, sometimes they're asking you the level of anxiety, but usually it's not going to be happen is because of the N class just been say, okay, actually the anxiety sometimes is very difficult to measure it. So you can see the picture here. So with this kind of a different kind of like a anxiety, so how can you measure this person is mild or the panic anxiety? Sometimes you just need to define like if they're like if they do have some symptom. That's how we can see, okay, this is mild or panic, or it's moderate or severe. But it's very difficult. So this is the reason that's why NCLEX, they try not to make this kind of question anymore. They don't asking you what kind of level of anxiety like this. But they did not say they will take out this question. So be careful, okay? So even in the future, you see this kind of question and try your best to answer it. But don't worry about it. So NCLEX is not going to put a very big percentage on this anymore. All right. But there's something they'd like to ask still. So the type of anxiety disorder. So that's why they're asking you, okay, what kind of anxiety like this? So they will give you like a story. They give you a scenario and asking you, okay, please tell me what kind of anxiety like this. So that's why they want you to know, oh, how can you just get a category with this anxiety? So that's why we can see, okay, if this anxiety, we can help or not. So you can see on my PowerPoint, 1, 2, 3, 4, 5, 6, 7. I have a 7 different kind of anxiety here. Okay, so the selected Mustin and is not It's not like some kind in a special situation in or event, but usually we don't really talk about this kind of like things. Okay, so that's why this type of anxiety usually is here. So generalized anxiety, that means what? It's nothing special. Just a patient just worry too much on something is not even making any sense. It's just worry, and could be with a reason or without a reason. Okay. If the people just go to like a panic disorder, that means what? Panic disorder is suddenly and usually will be effect to your vital sign. Maybe like a short of breath and like a blood pressure go high and the patient just have a palpitation. The heart rate is going faster. So that's why it's a panic disorder. Like a phobia. Phobia means what? The patient is kind of like very sensitive for some kind of like a spatial object or situation. For example, some people just get a dog bite before when they are little kids. So that's why when every time when they see the dog come over, they get anxiety right away. They get scared because they don't feel like, okay, I need to get bite again. So this spatial anxiety or phobia is also linked to the PTSD, the post-trauma syndrome. And like some people they're afraid about the high. Okay, just in a very high how you say like a airport something, so they feel like okay they're feeling very secure. So this is also some kind of like a spatial phobia. Separation anxiety, this is kind of like very famous. Okay, when you separate with somebody, is special people, and you created anxiety. So for example, like your child, okay, your son or your daughter. So when you need to come to school to study, or you need to go somewhere, and then suddenly just cry because they don't want to separate with you, like separate with the father or mother. So this is a very typical separation anxiety. So in the pediatrics, we're going to talk about this again, but this is for the kids, okay? But for the normal people, you also have a separation anxiety. For example, if you go to some event and we just separate husband and wife, so that's why usually, so one of our person, husband or wife, will feel like a separation anxiety. Feel like, okay, why you separate us? Okay, that's why we don't feel comfortable. Either way, in a school, so you know your friend very well. That's why you want to team up together, right? You want to do the clinical together. You want to study together. But I am the instructor. I will separate you. So that's why you feel like, okay, why you want to separate us? Okay, I feel some kind of anxiety because I don't know other people. So that's why this is a very typical separation anxiety. It's usually for the people. And then agoraphobia is a fear of being in the place. It's hard to escape. Okay, remember this category word, escape. That means what? It could be some kind of claustrophobia. Okay, in some certain of area, like for example, like an elevator, you feel like it's so narrow and so small, and you have no, uh, you don't know how to escape. So this is a very typical things. Okay, agoraphobia. And the social anxiety disorder, that means what? People doesn't know how to socialize. They have a hard time to talk to the people. They don't know how to say something appropriate, and they don't know how to talk. And we also see some people have a social anxiety, right? All right. So this is kind of like a category is kind of like more detailed. So unconscious will asking you for this kind of like a 7 anxiety usually. Okay. So I'm gonna teach you how you just see this kind of question. So that's why don't get worried. Okay, they have some kind of a spatial word. Okay, sometimes the anxiety will have some trigger. So for example, if this kind of social anxiety disorder, right? So people have a problem to talk in the social, or they have a problem to social, like with some other people. They have a certain anxiety and fear. So how can you take care? Take that person away for the social event first, okay? So this is kind of trigger. The trigger because of social event. So that's why we take out the trigger. Usually the patient anxiety will become better. Let's start with the generalize. So it could be have a reason or could not have a reason. So when you see the N class, usually the patient suddenly just worry or something like that, and without any kind of reason, that usually is a generalized anxiety disorder. So pick the answer. This one, that's not without a special reason. The panic disorder is suddenly just happen. Okay, it's constantly feel like a fear and also like a future attack, and this kind panic disorder usually will affect to your vital sign. usually will affect your vital sign, like a palpitation, like a blood pressure will change, and the patient have a difficult breathing. Okay. Social phobia, social anxiety disorder. So when you put this patient in certain of a social event, especially in the public, so this person they have a certain of anxiety. They don't know how to say, they don't know how to escape, they just don't feel comfortable in a social event. So that's why this is their trigger. So the key word is a social event, social situation, also the people in the public. Okay, if you see the NCLEX question have a public, that means that this is kind of social event. So how can we help these people? They have like a social event problem. So take them out from the social event, or we want them to social with the people, right, in the future. So refer them to the group therapy. This is a very good treatment, the group therapy. Why? Because we still want this person to have a good social activity, but they just don't know how to do it from the beginning. So how about we give them to the group therapy? So the group therapy maybe from the beginning, maybe have like 3 people or 5 people only. So that's why they feel more comfortable to talk to like a very small amount of people, not a big event of a people. Then eventually we could graduate, add on the people. Maybe in the future we can go to like 8 people or 10 people, or maybe like 12 people later or 15 people. So start with a Google therapy with a small and then eventually going bigger, more people. That's why they feel more stronger, they get trained better. So that's why in the future they know how to adapt to the social event better. Spatial phobias, okay, like a spatial object, for example, like a spider or high or flying, and some people get very scared by kind of spatial object, a spatial event or situation. If we don't have like a spatial event, the patient is okay, then fine. So, for example, some people just afraid about to drive. Okay, don't drive. How about taking the bus, taking the train? So they will become better. Agoraphobia. Okay, this is about escape. Escape. So this patient, they feel like okay, they cannot escape from somewhere, like from the elevator, or like a very small room, or when they go to the MRI. So that's why they have like a claustrophobia, right? So they feel like they cannot escape, and they feel like so scary. So this is some kind of like a escape. Separation anxiety is a separation. Okay, you separate with somebody, That's why they get feel like anxiety right away. And this is selective mutism. Okay, it's a feel to speak our spatial social event, our situation. This one is a little bit spatial. For example, like a school, if I suddenly just call you, okay, please come to the front and talk to everybody. How can you study? And why you can study so good. So that's why you didn't expect I will call you today and you didn't get prepared. Suddenly you just come to the front, you feel like, oh my God, I'm so nervous. I don't know what to say. And you feel like I'm sweating and I feel like, okay, I have a palpitation. So it's kind of like a suddenly happen. You didn't get prepared and you just feel to how to speak and how to adapt to that social event. Okay, so that's why this is a selective. Okay, it's not kind of like a social anxiety. This is a little bit selective. So social anxiety usually is kind of from all the social. This selective just for like for the spatial thing. You don't have any problems with social with the people. Just with some special exam, I just call you and I just want you to do in the public in front of other people immediately. That's why you have this kind of problem. All right, so we talk about so many. Let's practice a question. That's why you can understand better. The question number 1. A client report possesses a feeling of a fear of traveling, particularly on the elevator and the airplane. So, due to the concern about not being about to escape. Okay, this is the elevator and the airplane is a spatial object, right? You're probably thinking, oh, this is a phobia. But read the question careful. This is unable to escape. What is the most likely diagnosis? It's D, agoraphobia, because you cannot escape. Here, no. Here, remember highlight this one, escape. Okay, they feel like they cannot escape. That's why they have this kind of phobia. So that's why see the key word. do you see the keyword or something hiding in the question? So you can see the escape. That's why you can see almost like 90%. You say, okay, this is some kind of like agoraphobia. So this is a phobia. It didn't tell me what kind of phobia, right? Panic disorder. It didn't tell me if any kind of vital sign yet. Social anxiety disorder. The client doesn't have any social. It's not social. Okay. Let's see the question number 2. During a healthy assessment, a client decides to recurrent nightmare and also physical distress related to their fear of being separate from their child. Separate. You see the keyword here? So
Yes.
which anxiety disorder is most likely for these people?
D.
Yes, separation anxiety. See, if I told you it's not difficult anymore, right? Now you know how to choose the answer very easy right now, because the
Yes.
keyword. All right. Number 3. So a client assess a daily worry about the work performance and interfere with the function and also relationship. Okay, you probably think about it a little bit like a social, right? No, it's not in the social. What is the most appropriate diagnosis? It didn't tell me anything. It just worried about his job. It's not even like a social. He didn't say, okay, I need a social with the people.
Is it A?
Yes, generalized. Okay, this is general anxiety. Okay, it's anxiety. Because it didn't tell me something very special. It just told me, okay, I'm worried about my job. What kind of job? It didn't say. Which part of a job? It didn't say. Is that either way the due date you cannot submit to your job, or either way you're being late, you're gonna get fired, or either way the job is kind of like a heavy loading? It didn't tell me anything. So that's why it's generalized. Okay, so the client didn't have any effect to the vital sign. It's not a panic. So it's not social with anybody. It didn't say. So it's not social anxiety. So acute stress disorder. So this is not. It is stress, yes, but it didn't tell me anything about the stress yet. Okay, so not there yet. So we understand pattern right now. So Thursday, I'm gonna give you some kind of ATI and NCLEX question, so that's why you can practice. Okay, so that's why in your midterm and final, you know how to choose the category of the anxiety disorder. All right. The next one is a panic attack. So when anxiety escalates a certain level is high, so that's why we call it a panic attack. Okay, so the panic attack is gonna show you the vital sign change. It's also the physical change. Okay, so this is some kind of great things that I highlight read. That's why I want you to remember this. Okay. The first thing is a change the vital sign, your heart rate, and also your breathing, like a palpitation, and then you have a shorter breath. Okay, even the people will feel like, okay, choking sensation, feel like, okay, I just cannot talk, I just cannot breathe, like something, I'm being choking. But you can find out, okay, they're fine. They don't choke with anything, okay? But sometimes it's significant. You can see the vital sign is a little bit changed, okay? So this is kind of like a keyword. The change about some kind of vital sign is kind of panic attack already. Physical sensitivity, okay? So the feeling like a shaking, a sweating, chill, and like a hot flash, and a trembling, and with all the extremity. And their head and stomach, they feel dizzy and like a headache, nausea, vomiting, and stomach is cramping. A nerve is kind of nervous, okay, with like a tingling sensation. So you can see this is kind of like a change in the physical. It's changing the vital sign even. So that's why this is kind of a typical panic attack. So if usually it's not changing the vital sign, it's usually not panic attack. Okay, this is very important. Why? Because the NCLEX is gonna asking you, is this anxiety yet or is it panic yet? Okay, so panic usually is kind of change the vital sign already. So that means what? Is severe. Is a severe anxiety and panic level anxiety. Okay, it's this two. So this kind of become like a panic attack. All right. Let's see the next slide. So how did the panic attack just happen? Well, it could be happen suddenly without any reason. Okay, even while sleeping. So when your patient come to the facility, maybe for example, like they just admit. Okay, so when you admit the patient is suddenly just have like a panic attack. Okay, so maybe the trigger is the patient usually just stay by themselves, like a single room. But when you go to the nursing home, you need to share a room with another person, right? So like maybe two people or like one people. So that's why they suddenly have a panic attack. Say, oh my god, I don't know this person. I need to share my room with him. So what should I do? And I need to social with this person. So that's why sometimes no reason they suddenly just have a panic attack. It just suddenly happen. And usually the duration is not too long. So it could be like a typical like a 10 minutes or 15 minutes, but it could be up to like a 1 hour, 2 hour. So the panic attack usually duration won't be like over like a couple hours or even a day. Usually it's not. Because it's over a day, we can say this kind of panic attack failure. So that's different already. All right. How do you feel? How do they feel? Exhausted and fatigue, and follow with a panic attack, and repetition. So it's frequent, unexpected attack with some kind of panic disorder. Usually they have a trigger. Usually panic attack they have a trigger. Okay, but it could be without a reason. Okay, just let you know. If they have a trigger, so how can we take care? Remove the trigger. Okay, just remove the trigger. For example, if your patient just don't feel like, okay, I don't want a needle injection, it just made me feel like I'm so scary. So how can we help? We can tell the doctor, hey, can you change this medication in the pill form? Yeah, we don't need to use the IV, so that's why we don't need to poll the patient. Okay, if sometimes unfortunately we have to use, okay, the patient have a panic attack and say, I don't want a needle, so what can we do? We cannot remove the trigger. Calm the patient and explain the patient why we need this procedure. Very important. And tell the patient, okay, I need to check your lab. So that's why I have to use a needle to draw you. But don't worry about it, you're gonna get injury. Okay, I will be here. So I will help you. If you feel pain, I can give you some lidocaine. Okay, I can massage your arm later and give you the heating pad. Okay, so either way, how you gonna feel comfortable? Let me know. Okay, I will tell you. And how can you just being comfortable? I'll help you. So this is how we deal with a panic attack. All right, let's see the question. All right, so which physical and is kind of telling you might be the nurse is better to observe the patient is kind of experiencing the panic attack.
C.
Yes, it's significant change in the vital sign, right? And it's kind of not reasonable. Palpitation, tachycardia, and short of breath. Yes. Okay, number 5. Your patient is described experiencing the marked physical things like a peak with a 10 minutes and like occur like unexpected without a clear trigger. So what diagnosis is consists of with? It could be with a reason or could be without a reason, right? And there's a physical suddenly just become like a hyper like a palpitation or like a little bit like a heart attack, something like that. Yeah, it's a panic disorder. Okay, so anxiety, this is not apply anymore because it's already changed the vital sign. See, it's a physical change already. All right, so the NCAS also tell you, not NCAS, the textbook also tell you about like a motivation. So we can tell the patient, okay, so how can you just deliver with your motivation with your disease progress? Because one the patient have their own motivation, so how can they just face on their disease and they can management and also monitor by themselves? So for example, like a diabetes patient, so how can just I have your motivation to do the exercise or control your diet? So that's why we talk to the patient. So what do you think in helping you easy and better to control your diabetes by the exercise? So can you exercise in the morning or do you like doing like exercise in the evening before you go to sleep? So no matter what we need exercise, you just need to tell me so how you can do it. So this is some kind of motivation. So let the patient decide what motivation is good for them. Okay, but this is not an as a big question. Okay, you can read by yourself. And also frustration. Okay, everybody have a different kind of frustration. That's why sometimes they can know how to deal with their daily activity. So that's why we tell them how to overcome and adapt it. Conflict. So if you also struggle comfort with something and you don't know how to do it, and it kind of causes stress, right? So that's why you know how to deal with it. So that's why with all the last of what we do is like emotional support, and we set a goal for you. The goal we set like a short goal. Okay, don't set a long-term goal, because the patient will be easy to complete with the short-term goal. All right. So you also can read by yourself. All right. Stress. This is also another NCLEX question. Okay. So everybody have a certain amount of stress. Also the patient. So any kind of stress in the hospital or facility, it could be cause the patient reasonable or unreasonable. So for example, like in a double room or like in a single room, they feel like separate. In a double or triple patient room, they feel like okay, this is so many social for me. They don't like it, so cause their stress. Like being a student also have lots of stress, right? You also need to listen to me. For example, like right now, you cannot go to have fun. So that's why the stress have lots of reason and will change it to your physical and social, spiritual, and maybe also come from your economic, also like a chemical happening inside your body. Like for example, electrolyte imbalance is also cause your body stress. All right. Here's also another big problem is so stress is going to be active for your sympathetic nervous system. So that means what? You're going to trigger you. Okay, you need to be alert all the time. So that's why your blood pressure is going to be higher, blood sugar is going to be higher, and also you feel a palpitation all the time, and you don't go to pee, you don't go to poo. So this is kind of like a flight and fight. I don't know if you guys learned the flight and fight before. So it's kind of trigger your sympathetic nerve system. We're going to talk about it in the term 4 a little bit more, okay? So that means everything is going higher. It's kind of going more high alert. But here, NCLEX is like asking you something about like the stress, the symptom. So what will happen to the stress, and how will you happen some kind of symptom? You headache and dizziness, okay? You have a body aching, like a tension, like a digest problem. Usually, this is a very big category. So you don't eat well, upset stomach, nausea, vomiting, and diarrhea, and also affect to your heart and also your lung. So like a palpitation and like some even have some kind of chest pain episode, short breath, fatigue. So for the chronic stress, usually they feel fatigue, and they have trouble sleeping. Immune system for this is kind of like being long time already is chronic, so that's why you have effect to your immune, so you get sick easy. And also for your mental psychosocial, so mood change and also cognitive issue, that's why you become like forgetful, and also you feel like okay and cannot concentrate very well, and the mentally fatigue, okay, and your low self-esteem. Some people happen, some people does not happen. Okay, so that's why you read this by yourself. And your hobby could be changed, okay? Change your appetite. You're eating it could be eating a little bit more and eating a little bit less. Everybody different. This is also another thing NCLEX like to ask you. When the people have a stress, they like to do this. Substance abuse, okay, increase some kind of like alcohol, smoking, or like a drug abuse. Okay, that's why. Be careful this, okay? NCLEX like to ask him this one. Social withdrawal. They don't feel like they want to talk to the people. They don't want social. So this is also kind of like a social isolation. And then nervous behavior. They feel like kind of frightened or pacing, and they just feel nervous all the time. All right. NCLEX is like to asking you the stress management. Okay, how can you manage it with the stress as a student and also for the patient, for the family? We want the patient to go to physical activity like exercise, okay? Again, so lots of exercise, especially here, yoga. They like to tell you do the yoga is good. Okay, because it stimulates some kind of endorphin inside your brain. Okay, relaxing like a technique. So this is also another thing. That's why I highlight twice. So they want you to tell the patient relax and how to relax. A lot of different kind of relax, like deep breathing and meditation. Okay, mindfulness and like a massage. Massage and decrease your body blood pressure and also heart rate. Lifestyle change, okay. So like a sleeping and like a healthy diet and a limited alcohol. So cognitive like reframing, okay. Some people can do that, some people doesn't do that. So you can just read by yourself. Time management, give yourself more time. Okay, don't in a hurry to do something. That's why you feel stressed if you cannot finish it. And social connection. So even they don't want to talk to the people, we still want to have like a good social event. For example, we can refer them to the group therapies. Okay, remember the group therapy usually is a good thing. We like them. Okay, let's see the question. So your patient report frequently and just feel like overwhelmed at work and experiencing a toxic stress. So what initial intervention will be the most appropriate? That means what? We just telling the patient do something. Refer the patient to go to the psychiatrist?
No, C.
Don't do that, okay? Yeah, it's C. So instruct the patient on a deep breathing exercise they can perform at home. So we tell the patient do the deep breathing exercise anytime they want to do, even in the public, not just only home. Okay, so you will see, okay, B, this is good. Why we don't choose that? Because they can perform, not just at home. Okay, you don't need to do it at home. Anytime you want, okay? Conduct the guidance relaxation exercise with the client. Yes, we like to do this. Tell your patient how to do like a relax technique. Prescribe the medication. Don't give a medication right away. Okay, especially without consulting a psychiatrist. Don't do that. Because this is NCLEX, they don't want you to give a medication, give a treatment right away. But in the real life, we give a medication. Okay, just let you know. Okay. Okay, another one, number 7. So the nurse is taking care of your patient as complaint about frequent stress and also displays irritability. So what should the nurse assess first? Oh, I didn't put an answer for this one.
C.
Yes. Yes, the trigger. Okay, sometimes they do have some trigger, right? So remember I tell you, okay, for the mental health, if the patient have a trigger, we need to see, can we remove the trigger? If we can remove the trigger, so usually a patient doesn't feel like anxiety anymore, right? Yeah, so if we cannot remove the trigger, so we assess the trigger. Is that kind of necessary? And the patient need to deal with. That's why we need to tell them how to deal with that, the coping mechanism, how you cope with that. So that's why we tell the patient, okay, maybe some kind of like take a deep breath. You still need to do that, okay? So I'm gonna be here with you. Don't worry about it. Okay. This is illness behavior. Okay, when we tell the patient you are sick for some kind of a diagnosis, that's why they have some kind of a certain behavior. Okay, that's why they have some crisis and like a denial, anxiety shock. They're a bit like a grieving 5 stage. Okay, very similar, but a little bit different. Okay, because they don't have a withdrawal. The grieving 5 stage. Okay, the illness. Okay, so with a homeostasis imbalance. Okay, this is kind of like in the textbook, but NCLEX didn't ask a lot, so that's why you can read by yourself. Okay, I'm not gonna spending lots of time and let you stay here with me. Okay, you can see this is kind of a little bit like a 5 stage of grieving, but they just don't have something different. They don't have a withdrawal. All right. So the patient, the problem statement, okay, you can see when the patient they have some kind of like anxiety or panic attack, they have all this kind of problem. It's very easy to see. It could be effect to the physical, or could be effect to the mental. Okay, like feel like anxious, or either way, despair, grieving. Okay, and even like a physical, they cannot sleep. So you can read by yourself. Okay, usually they cannot just coping and adapt to their daily activity. All right. Your nursing assessment, okay? So when we assess the patient's behavior, okay, maybe they have a stress, they have a panic attack, something like that. We need to do something very important assessment is anything kind of like a trigger is also kind of like a safety issue here. Okay, so for example, the patient tell you say, I feel so stressed about my job. Sometimes I just feel like I don't want to deal with it. If I disappear in this world, is that better? If I don't live here, is that better? So that means what? Patient already have some kind of depression, maybe have like a suicidal ideation already. So that's why when you assess the patient, be careful. Is any kind of a safety issue there? The patient tell you something like, okay, I try to hurt somebody, or I will try to hurt myself, or either way, I will do something is not good for myself or good for the group of people. For example, I feel like okay, my marriage is failed. Okay, my wife just never understand me. We always have fight. So I just feel like I don't want to go home. Every day I want to go to a club. I just want to drink. So that's kind of a safety issue, right? So how much drink you are drinking usually? So who are these people hang out with you in the club? Which club you going to? Do you have any kind of idea and like you feel like depression and after you drinking? So this is going to be your assessment. Okay, you can ask a little bit more detail. So how do you feel like? How do you think about yourself? Is any kind of safety issue? Okay, this is very important. Okay, and also another thing is do not offer the patient any advice and also what to do. Sorry, wait me a second. Here's how. Stop. Stop. So sorry. All right. So, in the medical field, we do not offer the patient advice or what to do. Okay, even the doctor, we try not to do that. Why? Because patient is coming back to blame you. Okay, oh, you tell me if I don't do this job very well, so maybe I can think about to change another job. Now I quit my job, I cannot find any job anymore. I have a financial problem right now. I have even more stress. Oh, you tell me. So it's always somebody good for me. So that's why I divorced with my wife. Now I'm divorced man and she's asking me the huge money. I'm not happy. I'm losing lots of money and nobody be with me. I'm being so lonely. It's all your fault. So this is the reason never offer the patient any advice and also what to do. But as the nurses, so what should you do? We communicate with the patient. So we communicate with the patient and also we listen to the patient. But here you're gonna tell me, Patrick, so if I cannot offer any kind of advice, because sometimes you tell me we can offer advice to tell the patient, okay, you need to do the exercise, something like that. Is that kind of advice? Be careful, okay? I'm gonna teach you something, okay? This is so different, okay? Yeah, people were thinking about we offer the advice to the patient, okay, eat healthy, do the exercise, and think about something positive, right? So that's why you can say, that's advice. No, I'm gonna tell you, use a different word. You say, no, I did not advise you. I encourage you. Everybody listen to me here, okay? We encourage patient. We encourage family member. I did not give you the advice. So you can choose to do it or not by yourself. Did you learn something very important here?
Yes.
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 Okay. I'm teaching you how to walk, okay, also how to answer the NQS question, okay, that's why. Actually, in the real life, it's kind of the same, right? But in the law, these two language is different. Okay, if I advise you, I give you advice. That means what? I take a fully responsibility. If you do something is fail, okay, you're gonna blame me. But if I encourage you, that means it's your choice. You do it or not. You take your own responsibility. It's not from me. Okay, so that's why. I encourage you to do some yoga, okay, because it's good for your physical activity. You can do it or you don't want to do it. It's up to you. So that's why I did not advise you, okay? All right. So assessment with the emotional status, okay, you can see everything here, okay, about like how they do it with the general appearance and also the behavior and the speech, how they talk, and the thought and the mood, okay, and the function, okay, and how they judge with the people, judge themselves, and the potential danger, okay, this is very important. Do they try to danger themselves? Yes or no? Or danger to other people? All right. So your nursing assessment, okay, we have something kind of important. We use some kind of tool to assess the patient. The first one is a mini mental exam, okay? So usually it takes about like 5 to 10 minutes, and we'll check it with a cognitive impairment, such as like a dementia. So we use it to check a patient is the kind of patient is kind of forgetful, and also is extremely dementia already. Why? When some people they have like a panic attack or they have a stress, sometimes it's not because they have dementia. They become like a forgetful. They cannot concentrate. Okay, they cannot concentrate. So in that time, so that's why with this kind of like exam, with this phone, we can indicate to tell the people, the psychiatrist can tell the insurance or tell your boss to say, you know what, this patient is already has some kind of impaired over cognitive. So that means what? Maybe cannot pay the attention very well or forget so many things very easy. So you need the patient need a mental break. Okay, that means what? So you can asking your judge or asking the judge or in the court. Sometimes for the patient they need to have a mental break. They need to take a break and then will come back to work and come back to do something. So this is the form we use. Mini mental state. We say MMSE. Okay, so the perfect score is a 30, but nobody will get perfect. Okay, nobody. Usually it's kind of 28, 29. Okay, usually it's not. So that's why we can just score the patient. And another thing is PHQ-9. This is testing for the depression. Okay, and from mild to the severity. So that means what? We're going to see the patient how much depression they are going to be. But this form. Will assess the patient or patient will answer by themselves. I'm going to tell you in the real life, this does not happen a lot. You know why? When a patient they have a severe depression, they don't want to talk. They don't want to talk. So how can you assess the patient if they don't talk? They don't tell you. Right? So that's what I'm telling you. Okay. So this form usually is for kind of like for some patients, they still can talk. They're willing to cooperate. If some people they cannot cooperate, it's not working at all. Okay, so that's why you can just see the form by yourself. All right, mental crisis. So when this kind of from like anxiety or panic and go to certain even more higher level, it becomes like a crisis. Why we say this is a crisis? Because the patient is unable to cope. Okay, that means what? They cannot dealing with the kind of like a normal daily activity. It's kind of such a big fail. Or either way, they are going to do something dangerous. For example, like a suicidal thought or plan. They're trying to kill themselves. Okay, intentional injury or reckless behavior. Okay, self-injury, like they are hurting themselves, they feel like they don't have any own value for themselves, or hurting other people. Okay, or a nervous breakdown, unable to cope with the daily function. For example, unable to eat or sleep. The patient just have a mania phase. They don't sleep for like a 3 days or 7 days or 10 days, no sleeping at all. Becomes so crazy. So the patient just doesn't want to eat anymore. So that's why they just become so skinny and like a severe malnutrition. They die because they are not eating. Okay, so intervention you can read by yourself, and we just tell the patient what we can do. Because in later on, I'm gonna tell you with all the different kind of disease how we do it with like a more detail. Okay, this is all the intervention step and a goal and outcome. You can read by yourself. But here is a lifespan consideration. Okay, so for the people that have some kind of crisis, so what will happen? Right. The first thing is a kind of sensory will change. Okay, maybe we'll change like listening or hearing. They cannot concentrate very well, or mistaken and for some kind of disorientation. Okay, so that's why people were thinking about if they cannot concentrate either very well or either they forget very easy. They're thinking about you are dementia. So that's why they are thinking about the patient have a mental issue, you have dementia. No, again, we send the patient to do the message screening and assess first. Okay, so maybe the patient just have some kind of a message problem, like a thyroid problem, right? Or maybe the patient doesn't really have a dementia, just need a mental break. So that's why don't assuming the patient just label and they have a psychiatrist or they have a mental issue from the beginning. Okay, no. And also like a social isolation. We don't like anybody's social isolation. Okay, why? If the people does not have any kind of like a good social life, usually they don't have a good self-esteem. Okay, and also why we need a social. Another reason is because we constantly want people to watch this patient, to watch it and to oversee this patient. If a patient just isolates so long, nobody watching it, how can I know if the patient just killed himself or not? Maybe the patient died already. If a patient constantly come to the social event, at least I know the patient is a participant. I can see if this patient is taking the medication or they are doing well or not. I can alert, right? But if a patient is always isolated, I don't see the patient all the time. That means what? It's some kind of danger layer. I just don't know. Okay, and also relocation, it could be cause of stress. So for example, like you just change the patient from this room to another room, or just moving. Like for example, a very good example is for the kids, right? So maybe the father have another job, we need to move to another state. So they finally just have some kind of good friend in school, and we need a relocation again. So that means what? We need to move. So you're gonna say bye bye to all your friends. I'm sorry. So that's why they have a hard time to adopt it, and kind of like adoption, fear of adoption. And hopeless and helpless. For example, like if they have a family member die, like a spouse die, or their children die, they could be have some kind of like a depression or common with the common older people, potential suicide. Okay, be careful. And coping technique. Okay, we need to tell them how to just review the coping technique. Then we're going to talk about that in the future. Drinking and also drug abuse is also become another problem because they cannot deal, they cannot cope anymore. They may not want to kill themselves, but we use it with a substance that could be like a slowly killing themselves. All right, improving with the mental health. Okay, you can read this by yourself, and we just try to help. Okay, if not, we refer them to the psychiatrist. All right, so this is also another very big thing, okay, about the communication skill. So the NCLEX want you know something very important is communication skill. It happens in all the different kind of area. It's not just only in the mental health, even in the message, how you talk to the patient. Okay, but in the mental health, we emphasize again because mental health, we don't have any kind of measurement to measure the patient their disease, right? They don't have a normal lab. They don't do lots of they don't do the surgery for sure. So this is the reason. That's why it's no measurement. I cannot check a wound dressing and see if you get an infection. No, I can't because you just have mental issue. You don't have an open wound, right? And I cannot check it with your vital sign because you just done the surgery because you didn't have any surgery. So this is the reason. That's why we talk to the patient. It's become very, very important. We can see if this patient is okay or not. All right. So we say this communication skill is called a therapeutic communication. So it's about what? It's very therapeutic. It's actually by the communication we also can treating the patient better, can make them feel better by the talking. Okay, the first thing is a patient center. So we want to put a patient in the center. We always tell a patient, say, we care about you. Okay, you're in the center. So that means what? We all here for you. So we have a doctor, we have a nurse, we have a therapist, and we have like a speech therapist for you, even a dietitian and nutrition people. And we also have like a family group, supporting group. So for your father and mother, that's why they can better understand you. So we do this is because of you. Okay, we want to help you. So it's patient centered. They feel like okay, they're being paid attention. So that's why they're being valued. So this is building the trust. You're building a trust. So that's why we want patients to think about, okay, we trust you, so you can trust us. So when the patient trusts us, they will follow up with the treatment better. If they don't follow up the treatment, they don't want the treatment done. One of the big problem is the trust. Remember I told you, so how come the patient did not follow the treatment very well, right? The first reason is the patient did not follow the treatment. So one of the reasons is the trust. The patient doesn't trust you. Oh, I need to take this blood pressure medication, and the patient is not taking it. And the patient will tell you, say, you know what, I don't trust that doctor. I don't have that blood pressure problem. I just eat a salty food only. He's stupid. He doesn't know I just eat a salty food. That's why I have a blood pressure high. So this is kind of like a trust issue, right? Why don't you tell the doctor? Why don't you just communicate with the doctor? What's going on? So you can trust us. You can say that. No problem. So that's kind of communication. So active listening and also open-ended question. That means what? We always listen to the patient. Okay, do not just keep talking by yourself and tell the patient, okay, you listen to me first. Okay, no, the patient is the one talking. That's why you can assess the patient. Okay, what's the problem with their life or with their disease? Because you need to listen to them first. Okay, but sometimes we guide the patient. If the patient just talk too much. For example, can you tell me how you taking this medication? Oh, you know what? Yesterday I just eat a fish, and then I just go to the movie theater with my friend, and then I forgot to do something, and my mother was calling me, blah blah blah, like this, to tell you all the story. I said, oh, I just need to know why you didn't take this medication. So okay, wait. So why you didn't take this medication? You tell me so all the story. Why? Just let me know why. I know you have lots of distraction in your life. I'm so sorry for that, but I just need to know why, because I can take care of the problem for you. So that's why we just maybe shortage with their story, but we still need to listen to them. Okay, first, an open-ended question is that we just don't tell the patient just choose yes or no. Did you take your medication today? Yes or no? Yes. Okay. So, did you like this treatment? Yes or no? No. I don't like it. So that's why this is kind of like a terrible question. Okay, we don't want the patient to answer yes or no. So that's why we want to open an end question. That means what? I have this question totally open for you, and you decide where you're gonna end it. So the doctor just prescribe this kind of like a diabetes medication for you. It's gonna treating your diabetes better. So what do you think? How do you feel like with this kind of new medication? Can you tell me a little bit about this is a new medication for you? And the patient gonna tell you the story. Say, oh, I take this medication in the morning, and I feel like okay, this medication actually control the blood sugar better. So my sugar now is better right now, and I also take it in the lunch time. But you know what? Lunch is very difficult for me because sometimes I walk in and I forget to take it. So that's why patient will tell you the open-ended question. That's why you can tell the doctor, say, you know what? The medication actually is easier for the patient taking in the morning because he will forget to taking in the afternoon during the lunchtime. So that's why doctor will know, okay, how to adjust the medication dosage, right? All right, and the next one. We want a patient explore their feeling. How do you feel right now? And clarify. Okay, I'm not sure I understand. Can you explain that again? Why are we doing this? Why we clarify to the patients the story? Are you sleeping right now because you're tired? All right. So the reason we don't clarify is sometimes you want to make sure you want to emphasize did the patient did something wrong. That's why they need a further education. That's why. Maybe you listen to something like, for example, patient tell you say, you know what? I take this kind of medication with all other medication together. It's easy for me. For me, that's why I don't forget. That's why you say, I'm not sure I understand. So, did you just say you take this thyroid medication with the other medication together? Because this is a level thyroid thing. So, you should be taking it with the empty stomach. And because you feel like it's easy to take other medication together, you don't feel forgetful. You don't feel forgot. So, is that what you mean? I'm not sure. Can you tell me? So, that's why you want to make sure if a patient just says something or did something wrong, that's why you can clear. You can just correct the patient situation to validate. Okay, we want to get a good positive feedback to the patient. It sounds like you're frustrated with the new diagnosis. Okay, so that means what? It sounds like okay, you feel like okay, you don't know how to deal with like this. So that's why I do have some empathy here. I hear you. Okay, I know you're painful. Okay, do you want to tell me something about that? Okay, how can I help you? And sometimes the validation is kind of like also give a good positive feedback to the patient. Your blood sugar control very well. So it seems like you're taking your medication almost every day and you control very well. Also, you control you're doing your daily activity very well. So it's a very good job. You control your blood pressure very good. That's very good. Doing this, so it get a patient very good feedback. You say, okay, I'm doing something good, so I'm going to continue to do it. So this is a very good therapeutic communication. And also, see the same eye label, see the patient. Okay, do not avoid the patient's eye. Maintain the open, like relaxed posture, not just become like a nurse across your arm. And also believe the patient their cultural belief. Okay, You don't want to deny the patient their cultural belief. For example, if a patient believes something like, you know what? So I believe, in my culture, I believe if I take in the warm water with the medication is better. For example, like a lot of Asian, right? We like to drink the warm water, right? We don't like to drink the ice cold water. So that's why the patient say, I like to drink the warm water with my medication. Okay, that's fine. It's not effective to the medication problem. Okay, you want to drink in the water and the cold water, room temperature, hot water, no matter what. If you feel like it's okay, that's your cultural thing. Okay, I believe it. You can do that. Okay. The next one. Avoid asking the why question. Why are you doing this? Why are you doing that? So this is not very politely, and do not give like a false statement oh, you will be fine. Okay, it's kind of like no, you don't understand me. Just say I'm going to be fine. How can you know I'm going to be fine? I'm not fine right now. That's why I'm here. Do not offer in the kind of personal opinion or advice. Okay, we encourage the patient. Minimize the patient their feeling. Okay, that means what? Patient tell you, I feel sad because my wife just passed away. Oh no, you'll be fine. Okay, you're okay. You can overcome. I know you're a very big man. You're stronger. Okay, you're the CEO. You'll be okay. Don't do that. Okay, minimize the patient's feeling. All right, let's see some question. So you have a patient, okay, is upset after receiving the new diagnosis. So what therapeutic communication technique should the nurse is better to support the patient? Don't worry about that.
Well,
Is that
yeah, it's
helping?
a C.
Yes. Don't worry about that. No. The patient is a new diagnosis disease. They worry, okay? Change the subject. Don't change the subject. This is very rude, okay? Interpret the body language and ask open-end question. Yes. So tell me, how do you feel like this? Okay, I let you decide how you're gonna talk about that and where you're gonna be finish your subject. So providing saying everything will be fine. No, we don't do that. Okay. All right. Question number 9. So during a team meeting, so a conflict, so it's between two staff members on a difficult gender identity. Okay, it happened. It's, oh, you're the man, you make a better money for me. So that's why they blame each other. So what therapeutic communication approach should be the nurse leader to use resolve the tension? Okay, this is not a patient, but you're the nurse leader. Okay, for example, you have two CNA is arguing. Okay. Oh, because he's a man. Okay, that's why. So he should taking care more patient. So I'm a female. I don't want 10 patient. I want 9 patient. I want 8 patient. And your male CNA is fair. No, that's not fair. They're arguing. The correct answer is A. Each member by express their feeling using I statement. Why we use the I statement? For example, if this got two PCA, the male and female, they are fighting, right? So that's why you can either way ask each one and say, for example, if you ask a male CNA and say, so tell me, so how do you feel for this? Okay, explain your feeling, and you can start using your I. So you say, okay, I feel like. Personally, I feel like, okay, you cannot just because I'm a male, you just gotta abuse me. Every day I come over here to work because you're thinking about I'm a man, I'm more stronger. You always give me like over 10 patient. I'm also burning out. And everybody thinking about I'm a man, I should be more stronger. So that's why every day I need to taking care of the heavy loading patient. Sometimes, I also need some kind of a mental break or physical break. Okay, I don't feel like this is kind of fair to me. So I don't feel like. So that's why as a leader, you can see, okay, the reason I want to use the I because I want you to tell me how you feel. You are the center. Okay, you're the center. So that's why I can hear you. Okay, I will understand you. Okay, better because I don't want you to kind of change the subject. Say, everybody and is doing this. Okay, everybody's thinking about the man should take more responsibility. So that's why you feel like, okay, who is everybody? Who is that man? So that's why I don't care about everybody or any other body. I care about you right now. You are the one I care. So you can say I. That's fine. So that's why I want to hear from you. Like for the female, I say why you feel like it's kind of like unfair. I say, oh, you know what? I just come back from my pregnancy. Okay, so I'm taking care of my baby every single day. So I just come back. I also feel like it's exhausting. So that's why I feel like I need to understand. If some people can help me a little bit more, they can take one more patient from me. I'll be very appreciated. I say, okay, I hear you. So this is the reason we use I. Okay, remind that the workplace like discourage the personal disputes. No, we don't want this discourage. Okay, quit change the subject. No, don't do that. Okay, encourage the staff work it out themselves. No, don't let them work it out themselves. They're gonna fight. Okay, you need to call the police later. All right. So improve like your mental health continue. Okay. So you can do so many things here. Okay. You can talk and you can just give like a simple task. Okay. Don't give too many in one time. You can give like a one by one. You can walk in and like a sports and like a exercise, meditation or pray, relaxation technique whenever you like. All right. So this is another information. Okay, just read by yourself. Okay, this is not going to be your test. DSM-5. So this is kind of like it's kind of like a manual about like a mental disorder. So that's why if we do have some kind of like a mental disorder, we don't know how to define and we don't know how to diagnose and like a medication. So that's why we can going back to this kind of guideline and to find it. Okay, now is at version 5. So 6 is gonna be released maybe about like 3 more years later. All right. But here is also another thing. Do not provide a recommendation for the pharmacology and the treatment. So this is kind of like for normal therapists they use. It's not for psychiatrists. So psychiatrists they can use the medication, but we cannot. Okay. So this is the one used for like a normal therapist, like a nurse or like a physical therapist or like a occupational therapist and some other therapists. You can see okay how can we deal with the patient have a mental illness and how can we just help them. All right, question number 10. So a nurse is caring for the client is experiencing moderate anxiety. Which of following is appropriate nursing intervention to try give the necessary information to the patient?
D.
D.
Yeah, D is good. So don't tell the patient everything will be okay. No, it's not okay. That's why they're anxiety right now. Okay, use a low pitch voice and speak slowly. What does that mean? You talk very softly, okay? We usually talk to the elderly patient if they have a hearing problem, okay? Because they have high pitch voice, high pitch hearing loss, and speak slowly. Then like we talk to the elderly people, also to the kids. That's why we do that. So you basically just when the patient just get an anxiety disorder, for example, say I don't want to take this medication. Okay, it just made me feel like not feeling good. I think I have allergy for that. Don't worry about that. You will be fine. Try to take this medication first. So this is the way we talk to like an elderly patient and also the kids. Okay, this is not helping them. Ignore the patient anxiety. So we don't ignore, okay? So they won't feel embarrassing. So calm manner and using a simple and clear language, okay? So why you feel anxiety right now? Can I know? So the question is gonna be easy and simple. Okay, tell me a little bit more why you feel like anxiety right now. What happened? Okay, what just happened? So usually calm and also simple and don't use a personal judgment. All right. So any question?
Okay. Thank you.
Okay, you will
No,
have a
thank
question when
you.
you take an exam. Okay, so the mental health we're gonna practice a lot of question. Okay, so the Thursday we're gonna have your first quiz. I think you are gonna give 1 or 2 quiz only for this 3 weeks only. So during the class, I'm gonna talk about lots of like unclass question to you. Okay, that's why you don't feel like okay it's a misunderstanding. And also I will give you a study guide. Don't worry about it. Okay, mental health I will give you a study guide, and so you're gonna have a one ATI test and also one final. So that means the ATI test is going to be 2 times only. Okay, only 2 times. It's not gonna be like oh you have a midterm and also final and also with all the ATI like a message. No, mental health only have 3 weeks. So that's why your ATI exam is gonna be 2 times. Okay, one's gonna be your final. And assignment, I probably will put one more assignment. So that's going to be like a nice and easy. So that's why pay more attention and just study. Okay. So this is easy from the beginning. Later on, we're gonna learn some disease. You're gonna have lots of disease and also the medication. Okay. So pay a little bit more attention on your medication because they have lots of medication. It's very confusing medication. Okay, because it's not like a message medication. So that's why I will give you the study guide before the exam. But we're gonna review. Okay.
Thank you.
Yeah, and congratulations, everybody passed for your message.
Thank you.
Thank you.
Thank you.
You're
Thank
welcome.
you.
Let me
Patrice.
know
Thank
if I
you.
grade your
Thank you.
grade is wrong. Okay, let me know. I still can fix it. Okay, just test me. Okay, and tell me. Okay.
Okay. Thank you.
You're welcome. Okay, and go get some rest. Okay, you have a clinical tomorrow.
Thank you,
Thank
Patrick.
you.
Thank
You're
you.
welcome.
Bye.
Thank
Bye.
you.
And oh, I forgot to check your attendance here. No, that's fine. Next time. And